last week we announced a host of different metrics that we're using. We put them up on our dashboard to track where we stand in terms of looking for information to guide our next steps. The first measure that we looked at and have been looking at is the number of new cases in the setting of increased testing. So if you look at our dashboard, you can see that approximately 8 to 9 days of the last 14 days, we've seen decreases in the number of daily cases. Now, what's important to point out is that, yes, this has been in the setting of increased testing from our county resources, as well as new criteria that allows for and accounts for testing of asymptomatic individuals. This is completely different from how we were doing things in the previous couple of months. And so even in the setting of increased testing, we have seen declines in the average number of new cases on a daily basis. And it's important to put this into context with our test positivity measure. Again, remember that our test positivity is measuring the percentage of individuals who are coming back positive in the total number of tests that you're sending. So it's a good indicator to say that if you're testing more people, yes, you're potentially getting more cases, but if that percentage is coming down, that's a sign that you're seeing less transmission. And when we look at our curve that measures percent positive for testing positivity, we've seen a steady decrease in that over the last 21 days. In fact, on May 8th, we saw a high, our test positivity was over 30%. That number has now dropped below 20%. And actually yesterday we saw a test positivity of below 15%, which is where we said our goal would be. So we've seen increases in testing, we've seen decreases in the overall averages of new cases, and even in the setting of new testing, our test positivity is coming down. Another set of measures that we're looking at is the hospitalization rate for COVID-19. When we look at the total curve, we have been looking at the 3-day average for our hospitalization, COVID-related hospitalizations has been approximately 340, and this is out of a total capacity of over 1,600 beds. And that has been declining 11 of 14 days and continues to move in the right direction. When we look at the ICU rate, we have also seen decreases in that. The 3-day average for that is approximately 119. When we look at COVID-related fatalities, in fact, we have seen significant improvements in terms of our COVID-related fatality rate. Our overall average now is in the single digits. And in fact, over the last 7 days, the last week, the total number of deaths on a daily basis have all been below 10, again, moving in the right direction. Another indicator of severity of disease is also looking at the number of emergency room related visits for COVID-19 patients. Also on the dashboard, it says that, we've only seen 6 of 14 days, declining days. It's important to provide background reference for this is we're looking at a 3-day average of 17 visits across all the hospitals in the county in terms of folks showing up for COVID-related illness. That's significantly improved from where we were before at the earlier stages of COVID-19. And we're talking about maybe one day it's 17, one day it's 15, one day it's 18. So even if it's 6 of 14 days declining, we're talking about still a very low number of individuals, or much more significantly lower number of individuals utilizing the emergency room for COVID-19 related care. As you may recall from some of our previous discussions, the plan is to increase bed capacity by over 200 beds over the next 3-week period. We've worked very closely with the state to stand that up, and they are doing that in phases. An additional byproduct of adding additional acute care beds to our denominator is that would also allow for each of those facilities to free up intensive care space or free up other space that could be repurposed to provide critical care, adding anywhere from 30 to 40 additional beds that would be able to provide intensive care coverage.
Last week we said we thought we'd be able to open within a week to 2. We are still in that time frame. We think that's actually possible. And I feel pretty good about the numbers being where they are. I'm hoping that we don't get a weekend bounce from people going to Ocean City. That would be most unfortunate. But that notwithstanding, so far the numbers are pushing in the right direction, and we have solutions for, particularly the most problematic metric, which was the bed issue, which once we bring on additional supply of beds, then we know we've got capacity, and the measure of how many days is not as important as the fact is that we have the beds that we didn't have before.